Welcome back to the subscribers to the channel, and special what's up to the members of the channel themselves. I truly appreciate you. Hey, stick around to the end for a very special offer I have for you. For now, it's story time. So when the GLP-1 medications like Wegovy and Zepbound first hit the scene for weight loss, I was super excited, I'll be honest with you. And as a physician specializing in lifestyle medicine, I also knew that the science was strong. They were popping up everywhere, on a doctor's feed, when, the type of things that I read, social media, especially, let's be honest, always makes me a little skeptical. Because I also knew that these drugs were not magic. No drugs are, but eventually I did start to prescribe them. And that's when I slowly began to realize that the medications were powerful tools, and they are, especially in the area of lifestyle medicine, which I love and I specialize in. So this changed the conversations around obesity, just eat less and move more, to more of a let's treat this as the chronic disease we know it is, and controlled appetite while lowering inflammation in the body to improve metabolism. So when I first started prescribing GLP-1s in the first few months, I actually saw a dramatic transformation, a lot of them. Patients who had struggled for decades were finally actually seeing real and sustained weight loss. And blood sugars actually began to normalize. Blood pressures all of a sudden began to improve. Even before weight loss, joints felt better, less pain. Many of my patients told me they could actually finally recognize themselves in the mirror again, which is an amazing statement when you see a patient come in and they're actually motivated to finally do quote unquote stuff. And stuff means moving around and exercise. But then the cracks began to show. I started to have patients calling in a panic because their pharmacy said that the medication was out of stock for months. Others were paying up to $1,000 a month out of pocket or more because the insurance began denying coverage without warning. Some patients started splitting doses without my knowledge or skipping weeks just to stretch what they had left. Compromising their results and wasting their money and confusing me because I'm like, wait, we were doing so well. And then came the side effects calls. Some people had nausea so bad they couldn't eat for days, GI upset, disrupting their daily life. And in some rare cases, some more serious complications like allergies and stuff like that. Thankfully, nothing crazy, right? And I realized we weren't just prescribing an injection or some pill, we were actually prescribing a full lifestyle shift. And without the right education and support, these patients were at risk of failure or harm. They were coming into my office, even from other offices, with no direction. So the tipping point, a patient who actually worked really, really hard and lost over 70 pounds came back in the office and she was totally devastated. Her insurance suddenly stopped covering her GLP-1s, and within 3 months of stopping, she regained nearly half the weight she lost, like 30 pounds. And it wasn't because she failed, or she was in a failure, it was because the system did fail her. And she didn't have enough time, we didn't have enough time to build enough of the healthy habits she needed. And that's when I almost stopped prescribing, to be honest with you. That was a big one for me. And not because the medication didn't work, but because I refused to participate in a cycle of insurance promises, then games with insurances and pre-auths that they promise that they don't fulfill, followed by patient heartbreak. And we're left picking up the pieces in the office. Instead, what I decided to do is change my approach. I dove into these meds for real to understand what's going on. What could I do to improve our outcomes? And that's also when I started sharing everything on YouTube. I learned on this channel, right? So now I only prescribe GLP-1s as part of my comprehensive lifestyle program in this office. I give nutrition coaching, exercise planning, mindset work, the 3 dimensions and the 5 pillars, follow up every step of the way. And before we get started, we map out exactly what we expect to happen, where the medication will come from through the whole deal, and drill down the fact that these medications are a tool. And the foundation is actually education, changing lifestyle, and identifying barriers and triggers. And I'm writing an ebook now in a video series, which is mind-blowing to me, thinking about how this all started. And it's crazy. So if you want to get in on the early bird for the book, a waitlist for the ebook, check out the description below. We'll have a waitlist there. Anyway, so yeah, I almost stopped prescribing GLP-1s, which in hindsight sounds borderline crazy to me, given the multitude of wins my patients have seen since then. and the huge amount of interest I see now in changing lifestyle through healthy habit building and the hundreds of pounds lost since then. But I didn't. Thankfully, I realized in the right hands, with the right plan, the right mindset, the right coaching, GLP-1s can be life-changing. And with that being said, my job isn't just to hand out prescriptions. I don't just give them to everybody. It's to make sure my patients are set up for lasting success with or without medications like GLP-1. So I do turn away patients every day who are not candidates. Now, you may be watching this thinking, yeah, doc, sure, you're just saying this because blank, whatever you think. And that's fine, you can think what you want. But before you drop a crazy comment below, please just take the time to go through the thousands of unsolicited positive comments I have on my 300 plus videos now about lifestyle changes and medications. And people are finding a healthier version of themselves, and I'm here for it, totally. And just about 99% of the people in the comment section, I wasn't the one who prescribed the meds. So go figure. So that's just a quick story time of how we got from there to here. And listen, if you like the evidence-based info on my channel, go ahead and subscribe now if you aren't already a subscriber. And if you are thinking about starting a GLP-1 medication or need guidance, I'm going to point you in the right direction. Here's someone or a platform that can help. Let's take a quick second to talk about something people ask me all the time. Dr. G, do I really need to go through a dozen doctor's visits and jump through hoops just to try a GLP-1 medication and improve my chances of finally losing weight? The short answer? Nah, not if you do it right. Mochi Health is making evidence-based obesity treatment easier to access for so many patients, making them one of the best ways out there, all without sketchy compounding pharmacies, multi-level marketing vibes, or just trust me, bro, medicine. This is why I love what they are doing right now with weight loss medications and online support. They've got licensed clinicians who actually know what they're doing, and they help you navigate insurance or cash pay options with transparency. If you're ready to stop guessing and start treating your increased weight like the chronic medical condition it is, use my link below and check out Mochi Health. I'm sure you'll find the Mochi Health platform easy to use and their support helpful. So after you've watched all of my videos on GLP-1s, Mochi Health might just be the missing piece you've been looking for. Oh yeah, when you use my link, you'll get $40 off the first month. So give them a try today and get your GLP-1 meds the right way. Stay healthy, stay informed, and I will see you soon.